Friends, I am Dr. Phos. Welcome to my channel, Dr. Phos Presents. Tissue salt therapy, part 34, MAGPHOS 3. MAGPHOS for neck and back symptoms. Soreness in small of back. Smaller back is actually lumbar region. And in picture 1, lumbar region, this portion is called small of back. And neck, acute piercing neuralgic pain in the back which moves about. Neuralgia of intercostal region. Number 2 part, this is intercostal region. Much pain in dorsal spine. This is dorsal spine. This portion is called dorsal spine. Even touch is unbearable. MAGPHOS for extremities symptoms. Darting pain, especially on right side of shoulder and arms. Bone joints are painful. Paralysis, agitans or Parkinson's. This is a very peculiar nerve diseases. Parkinson's disease. You know, this is a very peculiar disease. In that case, when there is starting, you can use MAGPHOS. It may be that the disease will end in the nipped in the bud. Neuralgia and spasmodic muscles, contraction of lower extremities and worse at night. I will just remind one thing here. MAGPHOS looks after the white portion of the nerve, and CaliPhos looks after the yellow matter of the nerve. Now, when there is white matter disturbs, it disturbs generally the motor functions. So it is also a motor function, not central nervous system, not the gray matters, but the white matters of the nerve. So for that reason, the MAGPHOS acts in this type of rare disease also. This is continuation. 2 small dot means continuation of the previous. At night, current-like pain in legs, picture 1. Later, soreness in muscles, cramp in calf muscles, that is actually picture 1. Acute rheumatic pain in bony joints. Acute rheumatic pain in bony joints. MAGPHOS is used as an intercurrent remedy in rheumatic fever. Mind this, rheumatic fever is a very dangerous type of fever which affects the heart of a patient. In that case, this MP, MAGPHOS, is used as an intercurrent remedy along with other selected remedies. MAGPHOS for nervous symptoms, chorea 3. Chorea, chorea is actually movement of legs and hands, involuntary painful movement. It looks like dancing, but it is not dancing, it is actually disease. Contraction of the limbs is a nerve tissues tired, exhausted for want of nutrition. MAGPHOS for sleep symptoms. Spasmodic yawning, first figure. Lockjaw, second one. This is spasmodic yawning. This is lockjaw. The jaw is locked. Insomnia due to want of nutrition of nerves or owing to excessive depression. This is insomnia due to depression or excessive nerve affection, nutrition of nerve. Drowsiness, problems in sleep due to painful dreams, pains in necks and pain in occipital bone. MAGPHOS for febrile symptoms. Remittent fever owing to spasm in calf muscles. Chilliness at night after dinner. Cold waves move up and down along the back with tremor. This symptom is available in gelsemium of homeopathic drug also. Cold wave moves up and down along the back, the spine with tremor. Later, sensation of being choked. Severe chill sensation at 9 AM. Tremor of teeth. Bilious fever, profuse sweat. MAGPHOS for skin symptoms. Burning and stinging pain in corns. In corns, burning, stinging pain in corns. This is this picture. Barber's itch from infection of hair cutting or hair cutters. Rash over skin from insect bites, excessive troubles at elbows, knees and ankles. MAGPHOS for tissue symptoms, convulsion of various tissues and neuralgia. Nervous asthma, spasms of the glottis. Chorea, This picture has been shown here. Bad effect of harmful stimulants. Actually, tetanus. This is a picture of tetanus. This tetanus is a tetanus. It is extension of this lockjaw actually. Phos for circulatory system. Angina pectoris. Spasms of neuralgic nature. Palpitation due to nervousness. Better from lying down left side. Excitation of heart from trifle. Apex beat is visible over clothing. This is the apex beat area where the heart, while heart is beating, the heart touches internal wall. This is the portion, apex beat. It is in the mid clavicular region and fifth intercostal region. You can, in the case of MAGPHOS, you can see it over the clothing of the patient. Generally, this apex beat is not feeling. It cannot be seen. It has to be feel with auscultation of stethoscope by stethoscope. But in case of MAGPHOS patient, diarrhea, this heart is so over dynamic and hyper dynamic that it can be felt from over the clothing. Apex beat is visible over clothing. Whenever there is neuralgic or spasmodic pain in any limb organ, charging of MP MAGPHOS 3x repeatedly with warm water will dilute pain soon. This is very important instruction. Please remember this. Life case. My sleep broke with sound of calling bell. The clock showed time 1:50 a.m. On opening door, I found a boy of 14 to 10 standing outside the grill with an aged lady. Came to know on inquiry that a newborn baby of 10 days constantly raising hiccups. It had been doing so from evening, but its frequency was one hiccup in 2 minutes. Then, with the advancing time, night frequency increases. Now it was almost continuous. Baby did not take mother's nipple, neither went into sleep. Arriving at spot, I noted that mother was sitting with baby on her lap. Baby did not hiccup continuously, but raising one hiccup in every 3 to 4 seconds. Baby's abdomen was normal, often drew its right leg towards chest and threw it forcefully down. Pulse 110 pm. No other abnormality came to my sight. I handed over 6 grain of MP3X to mix with 6 to 7 tablespoons of warm water and give baby's mouth half small teaspoonful every 5 minutes, carefully. Next day, I got a call which informed me that after 5th dose, the baby went into deep slumber. Now it was sucking mother's breast and perfectly normal. With this, the video ends. If you feel any difficulty, please write down in the comment section. I will certainly reply. Thanks for listening and viewing.